Good afternoon, everybody. Thanks for being here this afternoon. Today, my remarks here that I'll make just at the outset, I want to make sure that they're intended for the residents of Sioux Falls, of course, but also for our entire region, as we're seeing increase in case volumes all across this region. And I wanted to kind of start today by addressing that with a chart here. So this map, what you're seeing is currently the active cases per capita, right? And this is an important chart for obvious reasons. Well, a lot of the healthcare capacity lives right here in Sioux Falls, South Dakota. The active cases per capita, as you can see, are really widespread across the entire state. So that's important because the messages and the remarks that you're going to hear today from our healthcare partners, because we're in Sioux Falls and because I'm the mayor of Sioux Falls, a lot of times the assumption is I'm speaking to the people of Sioux Falls. Well, as you can see, I really need the entire region and really the tri-state area, 5-state area, in fact, to really heed what's happening in our market right now. It's been another challenging week in our fight against COVID. Really, our hospitalization rate was quite flat for about 2 weeks. Over the weekend, we saw a pretty big increase here. There were some more discharges today that were just announced, but you'll see the primary difference if you take out this weekend, flat hospitalizations with a real sporadic case count. And so that's the trend that we've seen in the last 2 weeks. But in short, the virus is spreading at a pretty significant pace across the state right now. Our healthcare partners, which you'll hear from in a second, they're very busy. Their staff is working extremely hard. In fact, I might be ducking out of this press conference here at the end before it's over because I'm going to go do rounds at one of the hospitals with one of our healthcare partners because I want to talk to some people on the floor and kind of understand what's happening within the facilities. And they're very, very busy. And I'd be remiss if I just didn't thank again the men and women that are taking care of not just COVID patients, but all of our patients needing care during this time. I will be extending the facial covering requirement for the Sioux Falls City employees through the end of the year. And I would again encourage businesses in our community to consider a similar measure with their workforce. I'm doing it here primarily, I need to protect my workforce and keep them coming back and make sure I don't see a significant spread within departments. And so it's a smart thing to do to protect your workforce if you're a business owner. Many businesses are doing this on their own accord, but and to them, I just want to thank them for doing that. I want to remind everyone that we also have the SOAR program. Again, SOAR stands for Supporting Operations and Resilience. Okay, that program was specifically set up to help businesses and business owners adapt their business processes to operate during this time. So SiouxFalls.org/COVID-19 is where you can learn more about that program. Well, I believe firmly that facial coverings are one way we can prevent the spread of COVID. I don't intend to mandate the wearing of facial coverings in the city of Sioux Falls. And I just want to go on record on why you won't be seeing a mandate from my office on that. One of the reasons, we had a press conference last week called Mask Up South Dakota, and that included healthcare organizations from across the state, hospital systems, healthcare partners, and they went on record saying, quote, "This group is not seeking a mask mandate from government." And so I'm going to continue relying on our healthcare partners and the recommendations that they make on this to me. They currently aren't asking for that. Secondly, a mask mandate it's simply unenforceable, especially the one that you're going to hear tomorrow night. It's an unenforceable mandate. It also puts our law enforcement in a very challenging situation. And in a year that's been hard on law enforcement, I don't have any desire to do that. As you can see in the previous chart, a mask mandate would only be, a mask mandate would only be citywide in the city of Sioux Falls. And really, where the problem is everywhere. All right, and so A mask mandate in one municipality is a tough thing to say. It's going to be a huge needle mover across the region, especially at the expense of the challenges that mandate would bring. We already have fairly strong city compliance in the city of Sioux Falls. Now, people will argue with me on that. Given we're 2 days out, 1 day out from a huge political election, and as politicized as this issue has become, I think the compliance you're seeing in our city is pretty darn good, considering all the factors surrounding masks at this point. And lastly, businesses and residents have to continue to make the decisions that are appropriate for their situations. And I'm going to continue to just double down on that, especially vulnerable populations. I have to be extremely careful because when we look at that hospitalization number, a lot of those are vulnerable populations. I will continue, however, to be adamant on the importance of facial coverings. They can help slow the spread. The science is quite clear on that. I believe in that. And you'll see increased messaging and PSAs coming from my office on that in the days and weeks ahead. So bottom line today, my primary concern is for our hospital systems. Their bed capacity, ICU capacity, and the staff and the patients in those hospitals. Those beds are filling up, the staff are weary, and we must do our part to help protect them. And when I say we, everyone. As a reminder and in closing, here are the mitigation measures we need to see in this community. We need to see social distancing taken seriously. Tomorrow at the polls, respect people around you when you're going to vote. Give them proper distancing if you're going to vote in person. Wear your face covering. Wear your face covering when you're indoors and around people. Wash your hands often. If you don't feel well, don't go out. Don't go to work. Okay? Even the slightest little, if you're feeling off, it may be something. Get tested and don't go out. If mitigation measures can't be utilized or you don't feel safe, refrain from those large gatherings. Don't go. Okay? And if facial coverings and other things are important to you, patronize those businesses that are requiring those. More and more are in our community. You have a choice. You make the decision that's right for you. Bottom line, if there's one thing I'd like you to take away from this today, I'd like everyone to behave as if you have COVID. Okay? So assume you have COVID. And if that's the case, how would you act? Would you go over to your parents' house tonight? Would you go see your aunt and uncle? Would you go to school and visit a classroom? Would you get in a small conference room with your coworkers for lunch? Behave as if you have COVID right now. Use that mindset. We need you to do that for the next couple weeks, which would really help our healthcare partners tremendously. With that, I am going to turn it over to one of those partners, Mike Wilde with Sanford Health. Mike?
Thanks, Mayor Tenhaken, and good afternoon. Mike Wilde, Vice President Medical Officer at Sanford. At Sanford, we continue to be very busy during these times. Roughly 20 to 25% of our current inpatients are admitted with COVID, and that number fluctuates literally by the minute. We continue to work very hard to prioritize caring for patients as close to home as possible. We work very closely with our facilities outside of Sioux Falls, along with our Good Samaritan facilities, in addition to our home monitoring program as well, and continue our great collaboration with Monument, Avera, and the other healthcare providers in this state. A common theme that we're seeing as we look at the patients that we serve are not only those directly affected by COVID, but also a lot of stress right now, and we identified that through the spring and the summer. But there's a lot of people that are admitted, perhaps with an opportunity to take a little better care of themselves, but also those that unfortunately are misusing substances during this time, feeling that can somehow provide a relief, but also just tremendous mental health concerns as well. And that's been raised up before, and we continue to work closely with those patients as well. would really like to take a moment just to stress the need to care for ourselves. On a positive note, we fortunately have a break in the weather. It looks like great weather this week, so I think a wonderful opportunity, and actually data has shown it's a great chance to kind of help your mental health a little bit. Get outside, go for a walk, get the leaves taken care of, but focus on your own well-being. Maybe during these times, take a week, great weather, really focus on yourself, your medications, working with your primary care team. If you're not feeling well, get the help you need. Help is available via your primary care teams at Sanford. If you're stressed, if you're misusing substances, they're a call away, and understand it's a very stressful time, and it's okay to reach out during these times. Like the mayor stated, in the time of pandemic, that really you need to focus on your safety and staying home if you're ill, staying apart as able, washing your hands, wearing a mask. I think we really need to energize around this as people are tired of the pandemic, and I am too, we all are. But now is really a time where I think the energy devoted to that can really pay off. There are those who have lost loved ones during this time, and I don't want to forget that this pandemic certainly has tragic ramifications, and we see that. It's really a divisive pandemic in that there are those that are very minimally, if at all, affected by it, and then those that are tremendously affected by it, and that in itself can cause division. I'd ask you to be very thoughtful, like the mayor pointed out, about the choices you're making right now within the community that you're in. So if you are going out and about and trying to get back to normal, which I understand, have those thoughtful discussions amongst your family. Is it the right time to also go drop in on your parents or grandparents or loved ones that are older, maybe have some medical illnesses? Or is it a time where it might be best just to stay away for a little bit? Or if you do need to be there, is it the right time to be going out and about, or maybe make a little better choice to stay home and take care of yourself so you can take care of your loved ones? Finally, I'd like to express my true appreciation to the people of this area in Sioux Falls and the surrounding communities as well. Many are doing a lot of work, devoting a lot of energy to taking care of themselves, taking care of their neighbor at these times, and I'd really like to continue to encourage that and thank them for that. As I said, it's a divisive pandemic, and I think it's one we can all unify around. Simply taking care of ourselves. I think we can all agree that the best thing to do, if we're going to take care of anyone else, we got to take care of ourselves first. Really like to express my appreciation to the physicians, the nurse practitioners, the nurse anesthetists, the physician's assistants, the nurses, and all the other roles I'm not mentioning, who are really working hard right now to take care of people. They're working extra shifts, they're getting called in, they're trying to prioritize your care, and I think the best way to thank them is to follow the steps like we've outlined to really take care of yourselves, take care of your neighbors, and those around you. So with that, I'll turn it over to Dr. Elliott.
Thanks, Mayor and Dr. Wilde. Again, my name is Mike Elliott. I'm the Chief Medical Officer at Avera McKinnon Hospital. I'm going to try to bring this message forward from our physicians and nurses and all of our staff today, so that this comes from them. The numbers in general are going up. There's no good news here. Number of hospitalizations, number of deaths, number of active cases, number of positive tests, in general, they are all going up. Look at where we were in June and July as compared to now. The definition of exponential growth is there. It's staring us in the face. Our hospitals are stretched more than they ever have been. It's common for us to be busy. We don't have the capacity to take care of double the normal of people we care for on any given day. And yet COVID has done that, has stretched us. As Dr. Wilde said, we've got people working extra shifts, doing things that they're not used to doing, not comfortable with. We have got so many critically ill patients in our hospital, critically ill from COVID as well as other things. We just don't have enough critical care trained nurses. We don't have enough intensivists. We don't have enough people to take care of all of these patients that are coming in. And so our staff is stretched thin. They're pouring their hearts and souls into everything, into every patient, into every encounter. They're doing their darndest. They're tired, they're weary. The phrase I heard was bone weary. I think we're bone weary. But you know what? They're also frustrated. There's this horrible disconnect between what they see when they walk through the halls of the hospital, when they take care of these patients, when they hold a patient's hand as their last heartbeat occurs or as their last breath occurs. And then they go out into the community and they watch people gathering in masses of 100, 200 people not wearing their masks, not seeming to understand that this is real, folks. People are dying from this. And our staff just does not understand where that huge disconnect is